All right, can you all see my screen?
Yes.
Perfect. All right, we will go ahead and it is 11 o'clock, so we will go ahead and begin. Stretch that out a little bit. Okay, so good morning to everyone once again. My name is Damon Hoyle. I'm here at Texas Education Agency. I am the Senior Operations Project Manager, one of them, and primary responsibility has been managing our Reopening Schools grant, which is what the K-12 COVID-19 testing program falls under. So I want to formally welcome you all to the K-12 COVID-19 Closeout Reporting Training and Webinar. This is for for any and all public and private schools that participated for school year 2021 and 2022 and 2022-2023. So if you ever got COVID tests through this program, then this webinar is for you and it's applicable to you. I'm going to pause right here and ask my colleagues from DSHS, from the Department of State Health Services to come off, from the Texas Department of State Health Services to come off of mute and just briefly introduce themselves, and then we'll move forward with the presentation.
Hi there, I'm Diane Romness, and I work for DSHS on this program, and we're on the invoicing side. So when you get sent product from a vendor and then the vendor bills us, that's what we do.
And hello, I'm Anika Amy, and I work directly with Diane Romness on the invoicing side of the grant.
Hi, and I'm Victoria DeLeon, and I work with Shannon Richter, also at Department of Health Services, and I work on this grant as well.
Perfect. Thank you all. So they're joining me today. This is a collaborative effort. So once again, thank you all for joining us, and we'll go ahead and move forward. All right, so these next two slides are just disclaimers that we always show, just from a legal standpoint from us here at TEA. So I'll let you all read that. But basically what it says is that, we're here to provide information based on our interpretation and understanding of this grant from the CDC that went through DSHS, then came to us. It's not any legal advice, or anything of that nature. And if we were to find out any new information between now, this presentation, and the end of the grant, then some of these things might not be as relevant. We would provide you all with an update. So what you see today is based on the knowledge that we have as of today. So I'll go ahead and move forward to the next slide. This next slide and last disclaimer for today is that the K-12 COVID-19 testing program is supported by the CDC and the U.S. Department of Health and Human Services as part of financial assistance awards, which came out to be about $800 million given to Texas. The contents are not necessarily representative of TEA, but they are in accordance with the CDC and HHS grant. So just wanted to be clear there. Also, let me say this because I did not say this before. This entire webinar is being recorded. And so the copy of the recording and a copy of the slide deck that you all see today will be provided via email to the email that you got to sign up here. And it will also be posted on our website, on the TEA website. And I'll share that location and show you those locations a little bit later. So if you have someone that was not able to attend, or you want to go back and review this information, you will have the recording and a slide deck PDF copy of everything. All right. So session agenda, rather. We're going to go over our norms and reminders. Then we're going to review the purpose of why we're doing this closeout process, because we've had a couple of questions. Reminders of some important dates that'll be coming up between now and August 11th. We'll then go over the actual reconciliation form that each school system, public and private, who receive tests will be required to fill out. We'll walk you through that, and then Diane and Anika from DSHS are going to walk you all through some specific scenarios, because we know that this is nuanced and every school district has a different situation. So we're going to walk you through a couple of scenarios. We'll end again with some reminders and important dates, and then we'll go through Q&A. At any time during this presentation, if you have questions, there's a Q&A chat feature. So let me go to my norms and reminders. I'm already shifting into that. So here's our norms and reminders. If anytime you have a question, there's a Q&A feature at the bottom of your screen. Just click on it, type in your question, and our panelist will answer it either via type it out or we'll answer it live at the end. If for some reason we don't get to your question or we need to get back to you, we have access to your name and email address when you registered, so we would follow up. And if that needs to be a meeting, it can be. If not, it'll just be via email. I also encourage you to scroll through the questions so that you can see possibly your question might have already been answered. So that way you're not asking a question that's already been answered. But if you still need clarification, obviously this is the space to do that. If you, for some reason, you feel like you need to speak and say something because written form is not communicating how it needs to, just raise your hand and then we will have you, we'll enable you to come off of mute to share your question. This is for you. We want to make sure you get out of it what you need. Lastly, I already said this session is being recorded, so everything that we present today will be provided via our website and emailed out after the presentation. And outside of that, just engage. And once again, thank you all for joining us. So, wanted to start here just to make sure I make a quick distinction between this grant. So the Reopening Schools grant was an $800 million grant that Texas received from the federal government, from the CDC. TEA and DSHS broke that grant into two parts. The K-12 COVID-19 testing program, which is what we're here to discuss today, which allowed you all to be able to order PCR and antigen tests and staffing support to administer those tests if you liked it, if you wanted it. And that was through the K-12 testing program through those 5 to 6 vendors. The other part of the grant, which the school health support grant, that's when we sent you all direct dollars for other allowables like PPE and outside tests and wraparound services this year and all of that. We're not here to discuss the school health support grant today, although there might be questions, and I guess that's in a different form. That's not today. Today, our focus, our primary focus is the K-12 COVID-19 testing program closeout. So we would just ask that you keep your questions there. If you have questions about the school health support grant, we can assist you, just that won't be in this forum today. All right, I see we have a Q&A question already for our panelists. So, some of you might be wondering why we're doing closeout. The purpose of closeout is so that TEA and DSHS can get an accurate number of the tests that you all were given and how many are expiring, how many have already expired, how many will expire between now and July 31st, the end of the grant, and then how many will be left over unexpired after August 1 or after July 31st. So we are responsible as recipients of this grant to be responsible and to be good stewards of federal dollars and services and materials. And so this is our way of getting a more accurate number of what's out there over the past 2 years. So with that said, the closeout window and the closeout reporting process has already began. It started last Friday. Many of you should have received an email saying Friday, May 5th, which is last Friday, Cinco de Mayo. It was the last day that public and private schools could order tests from any of their approved vendors. So at this point, whatever you have in stock that's unexpired is what you can still use. The only exception, and I rarely even say this, but the only exception is unless there was a major breakout. We could see that on the CDC website about community levels, and it's beyond the number of COVID tests that you all have to cover that. Then in that emergency purpose, we would then issue tests. But outside of that, based on, we look at the weekly test data, and we look at the data from Test Weekly, that doesn't seem to be the case right now. So as of now, ordering has been shut down as of last Friday at 11:59 p.m. Next Monday, May 15th through August 11th, all school systems will submit a final reconciliation report form, which we will go over today during this session. This link will not be made available to you all until Monday, May 15th. So next Monday, it will be made available. Why is that? For one, that's the window that we've stipulated and laid out. But number two, in case something comes up today or we catch a bug or two, it gives us a little more time to tweak it so that when we publish it and make it public for you all on Monday, it's good to go. But all school systems, public and private, if you received one COVID test over the last 2 years, then you will be required to fill out this form, even if you filled it out before, because time has lapsed and more tests have been used or expired. So we need that accurate number. I already said this part. Second bullet point under here says, if a school system plans to administer tests during the summer school months, then you should wait till your final test is administered. So don't submit this report on Monday, the 15th, and then you go and test kids again the week after or throughout the summer. We don't want this until your last test has been administered for this school year. So if you know you're done and you're not testing another kid or teacher or staff member, go ahead and submit it Monday. But if you know, hey, we got summer school, we got summer camp, we do stuff in July, our board members might want it, don't submit it till you're finally done. You still will be required, and I'll let Diane jump in on this point, to fill out a test services and receive report. So there are 2 final reports you'll fill out. The reconciliation piece about expired and unexpired test, and then the TSRR form, which you all have been used to filling out. Diane, did you want to emphasize anything there about why they're doing the TSRR and the reconciliation form? You're on mute, Diane.
Thank you. Yes, so the reconciliation form that we want you to fill out this year, and one that you filled out last year at the end of school last year, was just so that we could get an idea of what the landscape looked like. How many tests were still out there that were still available to be used. Okay, so that was the reconciliation report. The TSRR is the official way to get them taken away as your responsibility. So if you received 500 tests and you used 450, we think you still have 50 of those tests available. And by filling out a TSRR, if those 50 tests expired, filling out that TSRR will then tell us, okay, they administered 450 and 50 expired. So then everything is even on that. So the TSRR is the official way to report expired tests. The reconciliation report that was done last year and will be asked to do again this year is just a view of the landscape as to what is still out there.
Thank you for that, Diane. All right, so that's the May 15th through August 11th. The reason we're giving you, some folks might say, well, the grant ends July 31st. Why do you have us filling out a report through August 11th? That extra 10 to 12, 11 days is because, let's say you test up until July 31st. It gives you time to finish your final inventory, gives you time, if you have tests spread out across the district, to just, it gives you that extra 2 school weeks to make sure your numbers are accurate to submit it. So we wanted to be sensible with our request in terms of reporting. So we gave you an extra 2 work weeks to get that information in. June 30th. So not this month, but the end of June next month. If you're still having staffing support to come on campus, which I only think is 1 or 2 school districts at this point, you can continue to have them administer whatever tests you have left. No, you can't order new tests, but what you have can still be administered by your vendor staff. You have until July 30th, the last day, June 30th, the last day of June, to do that. So in the month of July, if you still have tests and you are trying to test, you or your staff members or designee or within your district would have to do that. But we are allowing you to keep your staffing support through the vendors through the end of June. So I hope that's clear. Tests are done being ordered as of last Friday, but you can still use your vendor staff to administer those tests through June 30th. In July, you have to administer them on your own. All right. Friday, August 11th, that's the last day school systems can report COVID test results in the vendor portals. After that, they will be shut down. Now, I'm gonna say this and I'm gonna move forward because I know this is probably a question. Well, what if we have tests left over that don't expire till October or November or December? That's fine. Anything that expires after August 1 that you haven't used, you can keep. Those are your tests. You are not required to report that to the CDC, to DISHES, nor to TEA. We don't want those results because the grant is shut down and we're doing other things at that point. So those are your tests as a gift for all the hard work you've done during COVID. So those are yours. Yep, and I just pretty much said that. Okay, so now I'm going to move into the reconciliation form. So this is the form that will be released next. This is the form that's going to be released next Monday, May 15th, in the morning, that you all have access to. I shouldn't have stopped sharing. Let me go back. All right, you all can see it again, Diane, my screen. Okay, perfect. So here's a screenshot of the reconciliation form. I'm going to click there. It's hyperlinked. I'm going to actually go into the form and we're going to fill it out. I'm going to walk you through how to fill it out. While we're doing that, things that we want you to keep in mind for these next couple of slides, because I'm going to walk you through the general form, and then Diana and Anika on the next 2 slides are going to walk through more specific scenarios that you all might be in. So we're going to review the form, its basic features. We're going to discuss with Diana and Anika specific scenarios. We'll take any questions I will pause. What questions do you have about the form right then? And then this is just a reminder, this form will be available May 15th through August 11th. All right, let me stop sharing and then I'm going to share again. And the next screen you'll see that I share will be the reconciliation form. So here we go. All right. Diane, you can see?
Yep.
All right. So I made this big on purpose. So when you click on the link that'll be available on our website and be emailed out to you, you'll know you're in this form because it'll say test inventory 3. It'll then say this form is a dishes based or Texas Department of State Health Services form, and the title will say COVID test inventory closeout survey school year 22-23. Even if you did not order tests this year, or you did not use any tests this year, but you ordered tests, this form is for you. So although you see 2022, 2023, it is for anyone that got tests. So Diane and folks at Dishes, maybe we want to make a potentially add the other school year in there, but this is for everyone. All right. It then says this form must be submitted by each school system that participated in the K-12 testing program, funded through Dishes. Only report test numbers received from one of the following vendors. We don't want outside vendors. We don't want CVS, Walgreens, or anyone that you got donated tests from the fire department, none of that. We want tests that you went through this program, either from AccuReference, Achieve Health Management, Bloom, CDC, Goodside Health, Quest. Maybe you got it from Dishes themselves or Thermo Fisher. Let me be clear. Even if you used your own ESSER funds or your own district funding to order directly from Achieve Health Management, we don't want that. We want the test that you ordered through this program from that allocation sheet. That's what we want. If you give us other numbers, it's going to convolute the data and it's not going to be accurate. So just want to be clear there. Hopefully, I know most of you have been really good. If not all of you have been really good with keeping track and distinction between those. So then we go into the crux of the form. Anything marked with a red asterisk is mandatory. It will not let you submit it unless it is completed. So the first section says public or private. I'm going to choose a public school because I already picked a school that we wanted to use. And I'm going to choose Brazos School for Inquiry and Creativity in Katy, Texas, right outside of Houston. So you'll see once you start typing in your name, automatically your school number will come up, your ID number, your name will populate, your street address, all of that. Next is the authentication code. This is mandatory for you to fill out. It has a red asterisk. Some of you, for all of you, that's the same authentication code you've had prior to this when you had to fill out those other forms. If you're saying, hey man, we don't remember what that is, I don't know where I placed it, email us at COVID Case, we will send it right out to you. No, we don't make those public just because of the nature of this, but if you email us, we will send it right back to you with your authentication code. So I'm going to fill this one out. All right, so that authentication code is there. Making sure that's right. All right. Now it says make sure it's valid. Now I'm going to put my reporter email. I'm just going to put my work email here. You would put your work email here. Then your number, I'm just going to put 555. Whatever extension that might be, that should be. Whatever extension that might be, if you feel like you need to add in, this part is not mandatory. Your phone number and email is, because in case we need to contact you. If you have a reporting comment, something you want to add additional context to, just put it there. We read those. If we need to contact you, we will. But that's not mandatory. You don't have to put any comments. Next, you get into section 2, testing inventory and information. And I'll make this even bigger. So school district has finished testing for 2022, 2023. That means you're done. You're not testing any further. If you say yes, fine. If you say no, though, meaning you're not done, then it's going to pause you because you shouldn't be filling out this form, because this form is for when you're done with all of your testing and you're not testing anymore for this school year. So it's going to say this school district or school must complete the following before submitting this form. Finish your testing, report all your tests for your vendors, report what's expired to the TSRR form, and then once those steps are done, you come back to here. This is the final thing you do. report your results to the vendor portal, fill out your TSRR form, and then you come and fill this out. So I'm going to click yes. Then next it says, my school or district has reported all tests that have expired prior to today. So when you're filling this out, you're going to be submitting, and you're saying that anything that expired before the date of filling this out, I've reported that accurately. If you say yes, that's fine. If you say no, it's going to pause you again. And it's going to say, hey, you shouldn't be filling this out until you've reported those expired tests. We did that on purpose because we want to make sure and wanted to help guide you through this closeout process. Number of rapid antigen tests. You're simply going to fill it out. I'm just going to make up a number here. 25 tests expire before July 30 on or before July 31st. And then after that, we have 75. When I click, it's then going to add up that should be 100 tests. 25 expired before July 31st, on or before, and then after the grant ends, I have about 75 tests left that are still good because they're not expired. The expiration date is open and we've not used them. Now, here's what's you have to be careful with. Your number that you put here for number of unexpired rapid tests, let's say I say 90, it's not going to let me move forward because your numbers should equal. The number of unexpired rapid tests on hand should be equal to the sum. Am I doing this right? Yes. So we made it so that your math would math. It would add up. And if it doesn't, that might mean that you've counted tests incorrectly and you need to make sure that your inventory is accurate. So total number of rapid antigen tests expiring means in general, at the end of is 100, meaning 25 before, 75 after. The 25 before the grant date, end date, 75 after. If that number doesn't add up and you're looking at what you have in hand versus what you type, that means you have some tests out there that you're missing or you've miscounted. So please submit the most accurate information for us. And it's the same thing here. So that was rapid antigen, same thing for PCR. 25, I'll say 7, let's say 50, that should be 75. So my number here should be 75. If it is different, that means my count is off and it will not let you move forward. It won't accept it. So you have to make sure that what you say is accurate and then it disappears. Does your school district plan to offer COVID testing for 2023-2024 school year? You might. Let me be clear here. TEA and DISHES is not sponsoring any COVID testing programs after July 31st. This is just saying we're just interested to know, hey, maybe you have funding from another grant source. You have a lot of leftover tests, so you're going to continue with a COVID testing program. It just won't be through TEA. You would just click yes there or no, whatever that is. And then you save and close, and it's then going to go there to us. And then the form is done. It gives you another automatic response and you're done. But this should be the last form you fill out after you, if that message isn't right, Diane, we can fix it. But
Can you, so you hit save and close and then it came up to this. Can you scroll down and tell me what's at the bottom?
just saying
Okay.
report TSR.
Yeah, so Victoria, once he saved and closed, then a TSRR came up and it shouldn't come up. So if you could get with Sebastian about that.
Yeah, yes, I wrote that down.
Thank
I
you.
thought.
Yeah, and the reason Diane made that note, and then I'm gonna be quiet here and let Anika and Diane take over, is because once you submit this form, you're done. Your TSRR should have been filled out prior to this form, along with your vendor number of positive tests reported to the vendor portal. All right, so with that said, let me stop my share. Let me pause here. Are there any like burning questions, Diane, that we need to address before y'all get into the scenarios?
There is one from Kimberly Dans. She asked, what if we purchased our COVID tests with ESSER funds?
Got it. If you purchase tests with ESSER funds, that's not for this grant. We only want to know the tests that you got through the K-12 COVID testing program through our 6 vendors through this, and you saw it on the allocation sheet. ESSER funds that is not for this grant, you wouldn't fill that out here. I know ESSER deals with COVID, but we're talking about this program specific here. So even if you had ESSER funds and you got outside tests outside of this program, or you went through AccuReference to someone, that's still outside of this program. We want to know tests that were purchased through this specific program. Any other burning questions, Diane?
No. Brian, the email address for the authentication code is COVID case report, and we'll show that at the end of the presentation. It'll be one of the slides.
Yep. All right, and I'm just typing it in there for him as well.
Okay.
COVID case report. All right. So, and I just sent that to you, Brian, and we'll show it at the end. So I'm going to reshare my screen, and Diane and Anika are going to come in and go through some scenarios for you all. And all right, so let me go to, you can see it, right, Diane, my screen?
Yes, yes.
Perfect. So the following slides outline 6 scenarios that provide further guidance for school systems as they complete the reconciliation form during this closeout period. All right. So I'll let you all take it over. I'll turn it over to Diane and Anika.
All right. Can everybody hear me? I mean, can you hear me okay, Damon?
Yes, ma'am, we can hear you.
Okay. All right, perfect. So that you guys don't get stuck on listening to one person's voice, Anika and I are going to
I think she froze. Anika, did you want to take over?
Yeah, I think she did freeze. Okay. Yeah, sure. So let's go over scenario number 1. District A received 500. Are you back, Diane? No, I don't think she's back.
Am I? Can you
Yeah.
hear me?
You're back now.
Okay.
Yeah, you
Okay.
froze for a minute. Okay, go ahead.
Okay, sorry about that. So I just wanted to remind everyone that the reconciliation report that you did at the end of the school year last year, if you were in the program 21-22 school year, that was just a way for us to get an idea of what the landscape looked like, how many tests were out there, how many were going to expire before June of 22 and after June of 22. That was not your official way of reporting that your test had expired. So so just keep that in mind. All right, so the first scenario that we're going to go by, and if you have a different scenario after we finish, you can submit that information in the Q&A, or we can talk about it verbally if you want to. So the first one that we're looking at, we're going to say that this district received 500 antigen tests from one vendor, and that school district used 450 of those tests, and 50 of them expired on April the 1st of 23. And so the district submitted a TSRR, the official way to do it, on April the 2nd to report those 50 expired tests. And their testing has ended because they have nothing on hand, right? They've taken care of all of them. So what this district needs to do, since they're no longer testing, they're finished testing, school is getting ready to let out, May 15th comes, and even though they have 0 on hand, we still need them to submit a final reconciliation or inventory report on or after May 15th, stating that they have 0 tests on hand. And that's just so that we can make sure that we are familiar with what all school districts out there have. Because sometimes we have some school districts that may have received 500, but they've administered somehow more than 500. So we still want that information, even though this district has 0 on hand, we still want them to submit a reconciliation report on or after May 15th. Okay.
Okay. So let's go to scenario 2. We're talking about District B. So the school originally received 200 antigen tests from their vendor. Only 20 of those tests were administered, and 100 of those tests expired on January the 6th, 2023. The following day, January the 7th, the school reported those 100 tests as expired, and they disposed of those tests. Now the school has 80 tests on hand, and the expiration date for those tests have been extended to September the 30th, 2023. For this school district, testing will continue through summer school, and that's going to end in June. So this school will need to submit a final reconciliation report or an inventory report. Testing ends and they will specify the number of tests that are on hand that expire after 8/1/2023. And a note again, please don't submit a TSRR or dispose of any tests that are not expired. So out of those 80 tests, you're going to report on the inventory report how many of those tests are still on hand and how many of those tests expire after 8/1/2023.
Okay. And then the next one that we have is that District C received 1,000 antigen tests from one vendor. And 200 of those tests were administered and 800 expired on April the 15th. And this district has not submitted a TSRR to report those 800 tests as expired. And they still have them on hand. They haven't disposed of them. So what they need to do is to submit a TSRR to say 800 tests have expired and they need to dispose of the tests. And they can do that on or after May 15th. So, May 15th, they're already expired. So they can do that report on the day that opens so that they can get rid of those. Somebody asked about if we were going to talk about disposal of the tests. So I'll quickly go over it, that the tests that are unused are not biohazard. So what we do recommend is that you separate the recyclable material from the non-recyclable, recycle what you can, and dispose of the other things in the regular trash. We do not recommend that you just take a whole box and just dump it in the dumpster, because someone may dumpster dive and then say, well, look at what this school threw away, this whole box of perfectly good tests that they received, and it will not look good. So if you can separate them, break them down, recycle what you can, and then it can go in the regular trash. It is not biohazard unless the tests have been used. And next slide, Damon.
Yep.
Please.
There you go.
All right, thank you. So for scenario 4, we're talking about District D. The school district received a total of 700 antigen tests from their vendor. 500 of those tests were administered. However, there are 50 tests that expired on February the 21st, 2023. And an additional 150 tests will expire in July 15th, 2023. The school district has not submitted a TSRR report to report the 50 expired tests from February, and they still have those expired tests on hand. So what this school district needs to do is submit a TSRR report for those 50 expired tests and dispose of those tests, and also submit a final reconciliation report or inventory report when testing ends for the 2022-2023 school year.
And then the next one, and as we go down, you see that there's a little bit more information for these different districts. So this district received 300 antigen tests and 300 PCR tests from one vendor in 2 different shipments. 200 of the antigen tests were administered and 300 PCR tests expired on all 300 expired on March the 12th, and 100 antigen tests will expire on July 22nd, okay? So they have not submitted a TSRR to report the 300 expired PCR tests, and they still have them on hand. So they'll need to submit a TSRR for the expired PCR tests, all 300 of them, and dispose of them. And then when they have finished testing for this year, they will submit a final reconciliation report to document the number of antigen tests on hand that expire prior to July 31st of 2023, since they expired July 22nd. So if they finish testing on June 1st, then their report will say however many antigen tests that they have on hand on June 1st expire prior to July 31st of 23. Remember, on the form, it's how many do you have on hand, how many expire before July 31st, and how many expire after August the 1st.
Okay, so scenario 6, we're going to talk about school district F. This scenario is a little bit more complicated because we're talking about schools that have ordered from multiple vendors. So let's break this down. The school district received a total of 400 antigen tests from vendor F in 2 shipments. However, they also received 300 PCR tests from a different vendor, vendor G. So let's first talk about the 400 antigen tests that they received from vendor F. 100 of those antigen tests were administered, and 100 of those tests expired on April 22nd, 2023. The remaining 200 antigen tests have an expiration date of July 22nd, 2023. That's vendor F. Now let's talk about the second vendor, vendor G, the PCR test. All of the 300 PCR tests that the school received from vendor G expired on March the 12th, 2023. So again, we have 400 antigen tests from vendor F, 300 PCR tests from vendor G, 2 different vendors, 2 different types of tests. The school district has not submitted a TSRR report for the 100 expired antigen tests from vendor F or the 300 expired PCR tests from vendor G. And they still have all of the expired tests on hand. So action steps. First, let's talk about vendor F. The school will need to submit a TSRR for the 100 expired antigen tests from vendor F on 1 TSRR. That's for vendor F only. And then for vendor G, they will need to submit a separate TSRR for the 300 expired PCR tests. Again, you have to submit 2 separate TSRRs, 1 for each vendor. The school will also need to dispose of all of the expired tests, and then they will need to submit a final reconciliation report to document the number of antigen tests on hand, because remember, that's all that they should have left, just the antigen test. They expired all of the PCR tests. And you want to document the number that will expire before July 31st, 2023.
Thank you. Thank you all for that. Once again, you all will be able to see these scenarios. The purpose of that is to really, and thank you, Diane. Shout out to Diane and Anika for that. And shout out to Victoria, who's rapidly answering questions from the Q&A. So continue to send those in. But these scenarios were to help you all just for further detail and to work through whatever your situations are. So hopefully you all saw the benefit of that and you can go back and review those because they do provide a lot of guidance and insight. With that said, I'm going to go ahead and move forward. And we're now back at just another reminder, and we wanted to put this kind of book in this at the top of the webinar and then towards the end of it. So basic dates here, May 5th, all tests that you all were going to order should have been ordered by last Friday, unless there's an extreme emergency that the CDC says that there's a high rate of COVID in your area. If not, your ordering test is done. Starting Monday, you all will get the link via email to the same listserv that you got this webinar from, and it will also be posted on our website. You will get that, and that will officially begin this reconciliation format. Do not fill out that form that we just went over until your TSRR form is filled out, till your final results from your last COVID test have been submitted to the portal, which means that all your COVID tests are done. Anything after August 1 or July 31st, we don't need those test results. June 30th, if you're still testing right now, you can use your vendor. You can still have vendor staff support from your vendor come out through Friday, June 30th. If you choose to test in July, you would have to administer that on your own, train someone, designate a parent volunteer who's been trained to do that testing. Once again, August 11th, that is the last day school systems can report COVID test results in the vendor portals. Results that are administered on or after August 1 will not be required since the grant ends July 31st. All right. With that said, Accessing materials. So once again, this webinar is being recorded and has been recorded. We will provide the recording by tomorrow close of business on our website, and we'll send it out to you via email. And we're going to give you a PDF copy of this slide deck via email. And it'll also be on our website. So many of you might be saying, you keep saying website, where's the website? So this is a hyperlink picture. I'm going to click here, and it's going to take us to the website. Here's our website here. And we can provide that for you too. It's the K-12 COVID-19 support public health orders website. If you get there, you just click on K-12 COVID-19 testing program. It takes you right here. Under reporting forms, the vendor staffing log, but the TSRR form we keep talking about, it's here. You click there, the form is there for you. It's listed there for you, so it's there. There's also directions. If you need the directions for the form, that's also there. Hey, I don't know what I'm doing. There's directions there for you for that form. Under here, or at the top of here, on Monday, May 15th, that reconciliation form we just showed you, there will be a link for it right here with the date saying May 15th, and it will stay up there through August 11th. So that reporting form will be there for you. If you scroll down, webinars and presentations, we're going to clean this up. Upcoming webinars will be removed, and right at the top, you're going to see K-12 COVID-19 closing webinar training. It'll be listed there, and right under it, a link to the PDF of the slide deck. So those materials will be available for you tomorrow, this slide deck and the webinar recording tomorrow right here. And then on Monday, May 15th, the reconciliation form will be there. What we've done is we've added a date behind each of these links, most of them, so you kind of understand when they were posted. So that is where that is. What we will do in the email after this is I'll make sure that a link to the COVID website is in that link as well, COVID website link. And then what I'll do, well, it'll have to be an answer, but it'll be in that, it'll be in there when we get done. All right, going back here. Diane or Nika, do anyone want to add anything? And Victoria right here for this piece? Okay. Now we're where we need to be. So we're going to spend the remainder of our time. It's 11:42. This goes until noon, just answering questions. If you all want to add any clarifying information, you can, or if there's some questions that came through that we really need to address publicly, we can do that. So Diane or anyone want to jump in there?
Victoria wanted someone to verbally ask her question.
Okay, we should.
Victoria, who was that?
I'm gonna.
Vanessa Bazan.
All right, Vanessa, I'm about to find you, and I'm gonna ask you to come off of mute. Just accept that, and then it'll.
Victoria, I'm confused about the reason, while Damon's doing that, about the response you gave to San Marcos. It says, yes, they were opted in, however, they did not spend any funds. What does that, because they got tests from Achieve, I believe.
I need the school number to look a little further because I'm not
Well,
showing.
it's San Marcos. It's 105,902, I guess.
Okay. Well, we'll let you, while that's going on, I think Vanessa is here. Vanessa,
Yes, sir.
go ahead, ma'am, and thank you so much for joining us this morning.
Hi, thank you. Okay, so I have not done any testing this year. However, I do have an abundance of tests. Of course, we did a bunch last year. When I closed out last year, I do have those tests. Those tests will expire July 24th of 2023. So I understand that I should do the reconciliation form to report that. And then after they expire July 24th, should I just come back in and report those on the TSRR?
So, yes,
Okay.
but you shouldn't, so what, I want to make sure I understand what you're saying. So you're
Yes.
saying that you're gonna finish testing whenever, June 30th, we'll say.
Right, like after summer school.
Okay, so summer school's done. You currently, right now, you still have tests. You're gonna do summer schools, the few tests are administered. Summer school's over, you go in and you do your final reconciliation report to say that you still have however many tests. And then, yes, what we want is the day after they expire for you to
Okay.
fill out a TSRR form to report them as expired. However, you may be out of school, right?
Yeah.
You may not be a 12-month employee that works every month, that you're gone for the whole month of June. So if that's the case and you come back in August, the system will be shut down in August. So you won't be able to report those tests if you don't report them by July the 31st.
I see. Okay. If I have I can have access to my office really, so I can more than likely get in here and report that. That would be ideal, correct?
Yes,
Okay. Thank you.
yes.
Real quick, we got this question. I know that Anika and Victoria and myself are answering in the chat. I mean, in the Q&A. Anonymous attendee, do we report tests used after the end of the grant? I wanted to surface this again. If you look at this bottom, I went back to this screen. If you look at this last piece, the last day of school systems can report test results is August 11th. However, results of tests that are administered on or after August 1 will not be required because the grant ends July 31st. You are not to report anything administered or used after July 31st. We don't need that. We want to know what you have up until July 31st. We only are giving you to August 11th, just in case you need to go back and count numbers or finish inventory of things that were done prior to July 31st or prior to. Someone is asking Diane if you just want to Teresa Wright asks, is a TSRR, if the TSRR was completed too early, should I go back again?
Oh, no, you
Okay.
shouldn't go back again.
Okay.
So I may be using the wrong name. Teresa also says I may be using the wrong name. I'm talking about the form we report our unused tests on. So Teresa, I'm not sure what a unused test would be. So the TSRR is to report when you receive tests and when they expire. So if you're talking about results reporting, right? You did a test, the results are negative and you need to report that. That's done in a vendor portal. But the unused test could also mean your on-hand inventory. I think we need to, if we can bring Teresa in to explain that question.
All right, Teresa, I'm gonna promote you to invite you to come off of mute. Give me just a second. And then Diane, while I'm doing that, can you look at Kelly Maddox's question? Basically, she'll be off. Like a lot of school districts, they're closed in July. But her tests expire in July. She won't be back until August. So she's asking, does she still report those as expired?
Right. So if you finish school on June the 30th and your tests expire July the 23rd and you're out for the month of July and you don't go back to school till August 15th, when you go back to school on August the 15th, the first thing that you'll do is dispose of the tests, because you don't want those hanging around, those expired tests hanging around, and you will not have to report them because the system will no longer be available. Now, if you have an opportunity to report them as expired on July the 24th, between the 24th and the 31st, then that would be great. But if you're not there and not available to do that, then we understand that.
So question, Diane, no. If I know that they're going to expire on the 24th, we're done testing. Could I not just, and would it not be advantageous of me to expire them prior to report them?
We don't ever want to promote to fill out a form before they're expired as a just in case. You know, you don't know what's going to happen in the month of July. So we don't ever want to promote you to expire the test before they actually do. We recognize that on our end, that we know that tests expire in July, but the schools are not there. So we won't get a TSRR to report those expired tests. So no, we don't ever want a form filled out before they expire.
Got it. But if you have access to do it on the 24th or the 25th or whatever that is, you can fill it out. Okay.
Yeah.
I know that might have been a question. That would have been my question if I'm a school system. So, okay. Teresa, you should be able to.
Can you hear me?
Yes, ma'am. Go ahead.
Okay, so if we filled out the final reconciliation report, if we filled that out before the May 15th date, do I need to do it again?
So you haven't done it because it's not open. You don't
Okay.
have a link to that reconciliation report yet.
Okay, I'm almost positive I had a link in an email and I reported the amount of expired tests I had on hand.
Now, are you talking about what you did last year at the end of the school year?
No,
last
this was
year?
like week before last.
Oh, tell me your school name.
Redlick. It's Redlick. 2 words. And I
What-
might be able to, I mean,
So
I'm sure I
you
can find the
filled-
email.
So you filled out a TSRR on April the 17th. So
Okay.
last month, and you reported that 143 tests expired.
Yes, that's it.
Yes, so you already did that. And
Okay.
what you'll need to do now is, how many tests do you have on hand? Do you still have tests on hand?
I still have those 146. They're in a box.
But they're expired?
Yes.
You
But
need to get rid of them.
okay. So do I need to do another report after May 15th?
No, you don't have to do another TSRR after May 15th. You will have to do a final reconciliation to say, I have nothing on hand.
Okay. Okay. I see what you're saying. Okay. I appreciate your help. Thank you.
Yeah, and thank you for asking that, Teresa. And I want to remind everyone that anytime you have anything that's expired, you shouldn't be having it laying around. Because other people could pick up and expire. It's just like drugs. You know, if you have expired, you wouldn't keep expired aspirins
Right.
in your school or expired anything. So you need to treat these just like you do with other products that have an expiration date and dispose of them when they expire and not leave them hanging around.
Okay. Thank you.
Okay. I would like to know, there's an anonymous attendee who submitted a question that says, do we report tests used after the end of the grant, 7/31/23, on the SEFA? I don't know what SEFA is. Does someone know that?
I'm not familiar. I'm not sure if that's another like federal grant report or form.
All right, well, we can wait to see if someone. All right, Stephanie. Let me see. You sent me an email 2 weeks ago and I didn't respond. Let me see, Kaufman ISD. Kaufman ISD, we don't have any reports from you since January of 22. So I'm just going to tell you, email to Anika and we can work with you on that one.
I'm going to reshare my screen because I think, and the reason I'm resharing my screen right now is, so one of the things that I know, let me see, let me move this over so I can see. So the reason I'm sharing my screen is just for folks, there are 2 different forms that are QuickBase built. And so they might look similar, but they are different and they have different functions. This is, you can see the title, the COVID-19 Tests, Services and Receive Report form. That is different than the COVID-19 Test Inventory Closeout Survey. So they look similar, but they are different. The title is different. And you know it's the closeout form because it lists all the different vendors. The TSRR form does not list the vendors there, it listed at the bottom. So I'm saying all that to say these are 2 different forms. So make sure that when you're closing out, both are filled out because they're 2 different functions, 2 different forms. I don't know if you wanted to add anything, Diane, but I know just based off the last question, I wanted to make
Right.
sure folks saw the difference between those forms.
And can you go back to the other one, Damon, just to bring it to everyone's attention
Yeah.
that in the event, we usually talk about the 6 vendors: AccuReference, Achieve, Bloom, Goodside, Quest, and Thermo Fisher. But notice on there that if you had received tests from the CDC, DSHS requested.
Hold on.
Oh, DSHS requested those for you from the CDC. They were sent to you directly from the CDC. And also if you received any tests from DSHS, which was way back in the beginning, October, November, December of 21. If you have any of those tests to report, then they would go out on here also. You would include those as part of your inventory.
What do
Right.
Yeah, somebody says, no, we already got that one. Let me start from the, what this webinar will be recorded. Yep, that's already been answered. I'm just trying to go to questions that hadn't been answered. Let me go to open. Do we report test? So I still don't know what the SCFA is. My school name, that's being answered. Will we receive confirmation that our district has completed all requirements for closeout? Your confirmation is once you complete it, it'll say that. But Diane, they're asking, and I'm saying this for us when we debrief later and meet later this week, folks want to know, hey, they want an email or a notification, all of my correct forms have been filled out. That's what they're asking.
So that probably will not happen. So the vendors have been reaching out to schools to say that DSHS is looking for results or the number of tests or something. And so what they mean by that is the scenarios that were very similar. We sent you this many, you use this many, you should have this many on hand, but you haven't submitted a TSRR that anything's expired. And it was just a prompt to say, if they've expired, then you need to fill out a TSRR. As far as getting information that, okay, everything looks fine, that probably won't happen. And the reason that it won't happen is because schools are submitting the reports and we're waiting for the reports to be submitted. If you don't submit one, we don't know if it's because you're not testing anymore, or if it's maybe you're still testing, or maybe we contacted the wrong person or whatever. And then July 31st, the grant ends, and some of us that are on the grant, Anika and I, that are on the grant are going to be gone. So we're not going to be able to do follow-up to say, okay, yes, everything looks great, or were these extra 50 tests that are missing, or anything like that.
Just to add on to that, when you submit your final TSRR form, though, once you submit it, it gives you a confirmation blurb saying thank you for submitting it. I even think it sends you an email that says thank you for submitting it. The same thing happens when you fill out the closeout inventory reconciliation form. So once you submit it and you press submit, then you get that confirmation, then you're good to go. I will say this, and yes, the grant for you all ends July 31st. July 31st, 2023. However, if there is some extenuating circumstances past that point, you still might receive contact from someone regarding data. It's rare, but it still could happen. So I say that to say, please submit as accurate information as possible. And once you submit it, if you just need to know, let us know and we can confirm and so forth. Not saying that people need to do that, but yeah.
Damon, Vanessa asked again for clarification on the reconciliation report form and the TSRR, the way that you showed them on the screen.
I'll reshare. And we got about 1 minute left, and I want to be respectful of folks' time. So we'll take this as our last question. Any other questions we will have to answer via email or a separate one-on-one call. All right, Diane, I'll let you explain. This is the TSRR form.
Yes, so this form is where you reported that you received tests from a vendor, and whether it's antigen or PCR, and also the same form is used to submit that tests are expired. And if you used any vendor staff, then you would report them on this also. All right, so this is for received test and expired tests. And then the closeout survey, the test inventory closeout survey is what you have on hand when you have finished testing. So, you know, May 30th comes along and your school is closing, you have no summer school and you're going to be done. So May the 30th, you would fill out this form to say, I am finished. This is how many tests I have on hand that expire before July 31st. This is how many expire after August the 1st, and then you're done.
Yeah, someone is asking about the forms. In the closeout information, we'll send out all relevant links, all reporting links that you need, website links, all of that. All relevant links will be included in the follow-up, and they'll also be posted on our website as well. All right, with that said, it is 12 o'clock and I want to be respectful of folks' time. So I'm going to reshare this and do this in literally 30 seconds here. So let me go to this last slide here, share my screen here, and let me get you all out of here. So you all should see my screen. So thank you all for joining us. Any questions we don't haven't answered, we have a file that we can pull after this exported and answer it via email. If you still want to talk or chat, email us here at covidcase report@tea.texas.gov. That'll send a direct email to us, and then you'll get in touch with TEA and DISH's folks. Thank you all for joining. I think there's STAR testing this week or last week, but if there still is STAR testing, we wish you all the best. And we will be seeing you soon. Thank you so much for all that you've done over these past 2-3 years for COVID, for your staff, students, and school communities. Have a great one. Bye.
Bye-bye.